I think we have started. I'll just use the system to teach. Get the feed on. All right, so if you have joined, please kindly say good morning and write your name. So I can see that 2 people have joined. Write good morning and write your name. Good morning and write your name. Go to the comment area, type good morning and write your name. As I said before, I'm going to take attendance. I'm going to take attendance. So write good morning and write your name. Okay. I can see Omar Gombe. Okay. I can see Peter. I can see Carson. Saadatu. Okay. So what's the number of people in the class? How many people do we have in the class? What's the total number of students in the class? Okay, so that let me know the number I will expect. By the time we have up to 60-70%, we'll start. What's the total number of people in the class? We only have 15 people so far. Class rep, what's the total number of people in the class? I need to know so that we'll know the number of people. And I know that your class, you're far more than this number. But we'll continue. So, we stopped at the complications of diabetes. Can you remember the acute complications of diabetes that we discussed? If you can remember, type it on the comment. Acute complications of diabetes. Type it. Let me see. Discuss. Who remembers? Type it. Acute complications of diabetes. You people have to be interactive. This is just like a class. Acute complications. Very good, Kasim. Maimuna Kasim. Diabetic ketoacidosis. Very good. Any other person? Okay. Any other person? Apart from diabetic ketoacidosis, as you remember, diabetic ketoacidosis, we say that is commoner in people with type 1 diabetes because they don't have any insulin. And the meaning of diabetic ketoacidosis means that they have high blood glucose, that's the diabetes, they have ketones in the urine, and they have acidosis. That means if you do bicarbonate, you see that the bicarbonate is low. So apart from diabetic ketoacidosis, what acute complication did we discuss? Very good. So that too. Very good. You are very active. Hyperosmolar hyperglycemic state. Very good. Thank you for that. So today we'll continue with the acute complications because there's an acute complication that we did not discuss. And that acute complication is hypoglycemia. Hypoglycemia means that the blood glucose is low. That's just it, literal meaning. Hypo means low, glycemia means blood sugar. So hypoglycemia means low blood sugar. So hypoglycemia can be defined as any blood glucose in which there are symptoms, because sometimes the blood glucose level may not be as written in the textbooks. So any blood glucose in which the blood any blood glucose in which there are symptoms. But if you check somebody's blood glucose and it is less than 3.1 millimoles per liter for someone that is not diabetic, is hypoglycemia, right? So but for somebody that is diabetic, any blood glucose of less than 4 is diabetes. Let me repeat myself. Hypoglycemia can happen at any blood glucose. But if to put a value to it, if you are not diabetic and I check your blood glucose, any blood glucose less than 3.1 is hypoglycemia. But for people that are diabetic, if you check the blood glucose that is less than 4 is hypoglycemia. If you are with me so far, say hi. If you're with me so far, write hi. If you can hear me clearly, we need to be engaging that way so that I know that you're following. So if you can hear me clearly, say hi. Just type hi. Okay, good morning, Lucy Chiroma. Good morning. So if you can hear me clearly, type hi so that I can continue. Or you can write proceed, sir. Good, good, good. You're all hearing me. Very good. So with this definition, if in your PHC, if you check someone's blood glucose and you notice that the blood glucose is less than 4 for a diabetic patient, is hypoglycemic. But if it's not diabetic and you check it's less than 3.1, is diabetic. But the question is, how will you know that you have hypoglycemia? So initially, when the blood glucose starts going down, the body will react to it. The body will try to alert you to tell you that your blood glucose is low. So the way the body will react to it is through the autonomic nervous system. And I'm very sure they taught you about sympathetic nervous system, where the body produces adrenaline. So once your blood glucose is getting low, right, the body will react. And how will the body react? You start feeling hunger pants, right? You start sweating excessively. You start shaking, right? You start feeling eat something. So, but if you refuse to eat at the period of alarm signs, the body will go to the dangerous phase where the has affected the brain. So in that situation, you start having confusion, you start talking irrationally, you start having convulsion, and you may lapse into coma. So with this, you know that hypoglycemia can happen in two phases. The first phase is when you have the warning or alarm signs. Then the second phase is when hypoglycemia has affected the brain, right? So if you are following so far, say hi. If you're following so far, can you type hi? But if you have question, please write down can you type the question on the comment? Following so far, say hi. If you have question, type question so that I can answer. Type the question so that I can answer and we can proceed. Any question? For those who have question, type it. For those who understand, type hi. Okay. Khadija said hi, so she's understanding so far. Okay. Okay, very good. Oh, you're all understanding. I can see hi, hi, hi. Good. So, if somebody has hypoglycemia, what do you do? Because that is the most important thing. If somebody has hypoglycemia, what do you do? So what you are going to do depends on the severity of the hypoglycemia. So for mild hypoglycemia, listen very well. For mild hypoglycemia is when the blood glucose is diffused on the ranges of hypoglycemia. I say hypoglycemia depends on whether you are diabetic or not. If you are diabetic, hypoglycemia is when it is less than 4. If you are diabetic. If you are not diabetic, hypoglycemia is when it is less than 3.1. So hypoglycemia, please ensure that you have adequate data and you are using a good network, right? Because if you are not having a good network, you may not follow me very well, right? Okay, so I said that hypoglycemia in a diabetic is when it's less than 3, in a diabetic patient is when it's less than 4. But if you're not diabetic, hypoglycemia is when it's less than 3.1. And someone asked for the phases. I said the phase, you have the warning sign and the phase in which the brain is affected. So you have the warning and when the brain is affected. I said the warning is the one that you have sweating, shaking, beating of the heart, hunger pangs. But if it has affected the brain, so but if you have further question, please write it down. We'll answer it during question session so that we can move forward. Okay? So what do you do if a patient comes to you with hypoglycemia? So if a patient comes to you with hypoglycemia, the first thing to do is to know the severity. Is it mild? Is it moderate or severe? Okay. So please, as I said, if your network is not good, you will have difficulty, especially those who are using Airtel. You will have difficulty. So our advice for subsequent class, you use your MTN line, please. For those who are using Airtel, they may have difficulty. So for phase 1 is when the blood glucose is less than 3.9. No, I've already shared the slides. The slides for all my lecture is with the class rep. So if you were in my previous class, you remember that I shared it and he shared it with everybody. So you are going to see this period. You are not supposed to write this session. All you do is please listen. You have all the slides with the class rep, right? As I said, if you are not in my class, if you read the slide alone, you are going to fail. But the explanation is the most important thing, because if you read the slide alone, you have problem. So that's why the lecture is for explanation, but I've given my slides to the class rep. Okay? So if it is mild hypoglycemia, all you need to do is to give that individual any sugar containing food, like sugar itself, like juice, like honey, like anything that has sugar. You quickly give that individual. If it is mild or moderate, that it means, if when we say it's mild or moderate, that means it has not affected the patient's thinking, it has not affected the patient's brain, right? So if it is mild to moderate, you give the individual anything that has glucose, like sugar, like honey, like juice, like soft drink, to elevate the blood glucose. But if it is severe, then the individual needs to be admitted in the hospital and he needs to be given glucose through IV line. You need to admit the patient and give him glucose through IV line. Because if it is severe, that means the patient is either confused, it's either convulsing, or in coma. But the good thing is that if the patient is confused, convulsing, or in coma, once you give him dextrose infusion, the patient will wake up and be fine. So you can see that hypoglycemia is something that can be reversible, right? So this is how to manage it. But you may ask me, what are the causes of hypoglycemia? So the common causes of hypoglycemia, especially in those who are not diabetic, is starvation. You are not getting food to eat. The next thing is liver disease or kidney disease. Those individuals are prone to hypoglycemia. How about people that are diabetic? What causes hypoglycemia in individuals that are diabetic? First of all, is if you are giving the individual sulfonylurea, such as the popular downhill. I know all of you know downhill. So that downhill is very strong and can cause hypoglycemia. And if the individual takes drug without eating, it can have hypoglycemia. The next thing that can easily give hypoglycemia is insulin. Insulin can easily cause hypoglycemia, especially if your patient is on insulin and is not eating. So that individual can easily have hypoglycemia. Okay? So let me take questions on hypoglycemia. If you have question, please type it so that I'll answer it. Or if you need clarification. Any question? Laraba, Memuna, class rep. Any question on hypoglycemia, low blood glucose level? Abila, any question? I need questions so that I can clarify. If you have question, kindly state it. Okay, Abila said treatment of severe hypoglycemia. I say if it is severe hypoglycemia, that means the individual is unconscious or convulsing or confused. That one you need to give IV fluid that has dextrose. So usually you can use 10%, 50% dextrose in double dilution, or you can use 10% dextrose as an infusion. You rush 150 mils. So in severe hypoglycemia, you cannot really treat them with juice or coke. They may not even open their mouth for those things to enter because they are convulsing or they are in coma. So the best thing is to then someone asks, let me see. Okay. I said that the causes are depends on whether individual is diabetic or not. I say if you are not diabetic, one of the causes is starvation, then kidney disease. I said liver disease, right? These are the common causes of hypoglycemia in our environment. Then I said for diabetic patient, in addition to what I have listed, they are at risk of hypoglycemia when they are on sulfonylurea like downhill or they are on insulin. So if they are using these things, they are at risk of hypoglycemia, especially when they take drug and they don't eat. I said hypoglycemia is something that is reversible. So we don't want it to reach the extent where there is brain damage, there is vegetative state, there is death, or there is convulsion. Okay. Then who asked this question? Okay, causes severe. Okay. Then Lucy asks, how can drug cause hypoglycemia? You know, those drugs like insulin, it makes you utilize glucose. So if an individual uses insulin, let's say diabetic patient, and doesn't eat, that insulin will go and mop up the glucose that is already in the blood and cause hypoglycemia. And that's the reason why when you give an individual drug for insulin, you tell them like insulin, when you inject yourself, you eat 30 minutes later. If you don't eat 30 minutes later, the problem here is that you develop hypoglycemia. So that's why we advise if you are insulin, after injecting yourself with insulin, you eat 30 minutes later. Okay. Then any other question? Let me see. So Memuna asks, how can we dilute 50% dextrose, right? So this 50% dextrose, as I told you, Memuna, is obsolete because it's hectic. If you if you are using like 20 mils syringe, if you draw 10 mils of the dextrose, you draw 10 mils of normal saline, and you have to do that 5 times. So it's cumbersome. So what we do here is what we do here, instead of giving that 50 mils or 50% dextrose, what we do, we just give 150 mils of 10% dextrose water. 150 mils of 10% dextrose water. That's what we use, and that's the easiest way to handle it. Because if you say you are going to dilute that 50% of 50 mils of 50% dextrose, you're going to be hectic. That means you draw 10 mils in 20 mils range, you draw 10 mils of normal saline, you give it, you come back again, you do that 5 times. But if you have 10% dextrose water, you just give 150 mils, it will suffice, because that will give you 15 grams. Okay, any other question? Any other question? Or if you're all okay, say proceed. Okay. So that is having, if it has affected the brain, how will the patient present? That's what I said earlier. If the hypoglycemia has left the warning sign, has started involving the brain, what you will see is convulsion, confusion, and coma, loss of consciousness. Right? That's the sign that's affected the brain. And if there is delay in treatment, it will cause brain damage. And if it has caused brain damage, no matter what you do for that individual, he will not wake up. So hypoglycemia, though reversible, it is time sensitive. It is time sensitive. So you need to treat that individual as fast as possible. Any other question, or we move to the next thing? Any other question, or we move to the next? Good. Abila said proceed. Okay. No, for patients with diabetes and are suffering for Parkinson, is there medication for the symptom? So this one, uh, who asked this question? Halima. Okay. This is not part of the class, but there's drug for Parkinson. We call it Cinemet, right? So you can give Cinemet for motion disorder. If you are diabetic, we give what is called Cinemet. It's used to treat it. Okay. All right. Okay. Abila said proceed. Okay. So far so good. Mariam Mukhtar said proceed. Good. So let's proceed. The next complication we are going to talk about are the chronic complications of diabetes. We have left acute complications of diabetes. So we are proceeding to chronic complications of diabetes. Okay? So for the chronic complications of diabetes, they are what we call vascular and avascular. But for you, that will make it complicated. So we'll just discuss the vascular. And the vascular complications are divided into microvascular, microvascular complications of diabetes, and macrovascular complications of diabetes. That means microvascular affects small vessels, macro affects big blood vessels. So for today, we will discuss the microvascular complications. And one of the common microvascular complications is okay. Rebecca is saying I didn't answer her question. Specific food for people with hypoglycemia. No, as I said, any person that is diabetic or at risk of hypoglycemia, the important thing is you should always have sugar at home. Sugar, honey, soft drinks. So that anytime you have the warning signs of sweating, shaking, palpitation, hunger pangs, you take them. So what individuals at risk of hypoglycemia should always have at home is anything that will help anytime they have hypoglycemia, like sugar, honey, soft drinks, and juice. Okay, so let's continue. So, for the microvascular complications of diabetes, we have retinopathy when diabetes affects the eye. So, how does diabetes affect the eye? Once the blood glucose is high, it will accumulate in the eye. And once it accumulates in the eye, it will damage the blood vessel in the eye. So once the blood vessel in the eye is damaged, there will be decreased blood supply to the eye. And that's what we call retinopathy, when the blood vessel to the eye is affected. And this is, and please note that diabetes is one of the commonest causes of blindness worldwide. So any diabetic patient that is complaining to you about poor vision, you should quickly refer that individual where he can get specialist care. So how do diabetes patients with retinopathy present? First, they will have blurring of vision. So if they used to see clearly, they will not see clearly. If they used to read clearly, they can't read clearly. They cannot see the board. Like you, the students, you see that while sitting maybe in the middle or at the back, you cannot see the board clearly. It's a sign that the eye is not functioning well. You see that at home, you'll be bumping into chairs, objects, you'll be falling down. All these are signs of diabetic retinopathy. So once you have diabetic retinopathy, right, the issue is what is the way out? It is advised that any diabetic patient with retinopathy any diabetes patient, whether with retinopathy or not, should check the eye once a year. So every diabetic patient must check the eye once a year. And if a problem is detected, he has to go and check that eye at least twice a year. So that the problems, if there are issues with the eye, it can be detected and reversed. You understand? Because if it's not reversed, it can lead to blindness. So, but how does a diabetic patient ensure that he doesn't have diabetic retinopathy? One of the ways that you can ensure that you do not have diabetes retinopathy is having very good blood sugar. Okay. Secondly, ensure if you have hypertension that the BP is good. Also ensure that if you have problem with cholesterol, you try and treat it. All this one puts you at risk of problems with the eye. Then if you're smoking, you must stop. So if a diabetic patient does all these things, the sugar is good, no problem with BP, no problem with cholesterol, there is high chance that he will not develop diabetes retinopathy. So if you're following so far, please type hi so that I can proceed. Type hi. If you're following so far, type hi. I can proceed. Okay. Very good, very good. Thank you, Memuna. Thank you, Nuruddin. Okay, so very good. All right. So if this is how to deal with diabetic retinopathy, then the next thing among the microvascular complications of diabetes is diabetic neuropathy. When you hear neuro, that means the nerve is affected. Neuropathy, diabetes that has affected the nerves. So the same way it affects the eyes, it can affect the nerves. So if the blood vessel that supplies the nerves with nutrients is the one affected, so that the nerves don't have enough nutrient. And if the nerves do not have enough nutrient, they present with various symptoms, right? So the problem with the nerves, if you remember your anatomy and your physiology, we have peripheral. So if it involves the peripheral nerves, what the individual present with is problems with their hands, abnormal sensation affecting the hands and the feet. What are the sensations that they will have? They will have tingling sensation like prick, like something is pricking them, right? They may have burning sensation like there's fire, right? Absent sensation. This is the most serious aspect of diabetic neuropathy. When they have absent sensation, even if they put their legs on fire, on uh, hot charcoal or anything, they will not feel it. They can even step on a nail without feeling it. Okay, so this kind of situation, right, the patient will be at risk of injury and infection on the foot that will subsequently lead to amputation of the hands or feet. So diabetic neuropathy is one of the commonest complaints of diabetes patient and one of the commonest complications of type 2 diabetes. So for you, all of you, if you're having any tingling sensation on your hands and feet, please go and check your blood glucose. It could be that is diabetes neuropathy, especially the peripheral neuropathy. Okay, I've seen that the number of the class has reduced to 37. I'm taking note of people that are paying attention and active. I have package for them. Okay, so if you have diabetes neuropathy, the best thing, who are at risk of diabetic neuropathy? Those who their sugar is not good, those who their BP is not good, those who cholesterol is not good, those who smoke, those who are very tall are more at risk of the neuropathy than other people. All right. So if diabetic neuropathy is not treated, that's when they have wound that doesn't heal, right, and lead to amputation. I remember one of the student asked why their wound doesn't heal. The reason the wound of diabetes patients doesn't heal, one, the sugar that is high serves as food for the bacteria. Two, the sugar that is high also serves prevent wound healing. So that's why the wound doesn't heal. But if the sugar is good, once they develop a wound, the wound will heal quickly. Okay, so let's ask questions about diabetes retinopathy and diabetes neuropathy, the eyes and the nerves. If you have questions, please ask questions so that we'll answer it. Questions on diabetes retinopathy, diabetes affecting the eye, and diabetes neuropathy, diabetes affecting the nerves, tingling, burning sensation, and other things. If you have questions, please ask on diabetes retinopathy, diabetes neuropathy. If you do not have question, you can write proceed. I have my questions as usual. But if you have questions, ask. If you do not have question, write proceed so that Abila said diabetes neuropathy not clear, sir. What aspect is not clear? I said diabetic neuropathy affects the nerves, right? Diabetic neuropathy affects the nerves, right? And when it affects the nerves, the peripheral nerves, it causes damage to the nerves because the blood supply to those nerves, right? Blood supply to the nerves is reduced. So those nerves develop damage. And once the nerves are damaged, they start presenting with certain symptoms like pricking sensation, tingling sensation, burning sensation, and sometimes no sensation. Even if they touch them, they don't feel it, right? So that's peripheral nerves. But it can also affect the autonomic nervous system, which I didn't want to bore you with, but I can mention one aspect. If it affects the autonomic nervous system, it's the reason why their skin is dry, and it's the reason why some of them are impotent, because the autonomic nervous system, especially the parasympathetic nervous system, is responsible for erection. So that's why some of them have poor erection. All right. Someone asks, what are the causes of diabetic food? So the causes of diabetes food is just what I listed now. Diabetes neuropathy, or if you have diabetes peripheral vascular disease, that means there's not enough blood supply to the leg, right? Or if you have poor glycemic control, that means when you get injury, that wound will not heal. So it's a combination of problem with the nerves, problem with the blood vessels, and problem with your blood sugar. All this one will lead to diabetic foot. Diabetic foot is just like an injury seen in diabetic patient that does not heal. Okay. Uh, Abdul Rashid asks, sir, neuropathy can cause swelling. Can neuropathy cause swelling of the joint? No. Swelling of the joint is caused by either osteoarthritis, which can be traumatic for somebody that has had accident, or due to age. So swelling of the joint is caused by either osteoarthritis or gouty arthritis. Gouty arthritis, you see it when you have high uric acid. So neuropathy should not cause swelling of the joints. But if you have diabetic foot and infections enter, it may cause a swelling. Okay? So you people have not asked question about the eye, diabetes retinopathy. Does it mean it's clear? Okay, okay. There are other questions. What are the factors that can increase risk of developing microvascular complications, sir? And so the microvascular complication, the risk is having poor blood glucose level. If your sugar is not normal, fasting 4 to 6, as I discussed with you people, random 4 to 10. If your blood glucose is not normal, that means you are at risk of developing the microvascular complications of diabetes. Okay. Then some complain that this sensation, but the glucose level is between 4 to 7. Yes. So if I told you in Marcos Yakubu, sometimes, right, if you see that they are having complaint, but the sugar is normal, I told you to go and do glycated hemoglobin, right? Because it's possible that their random is bad. So you know that the glycated hemoglobin or HbA1c is a combination of both fasting and random. That will tell you the truth if their sugar is actually normal or not. But if you confirm that their sugar is normal, there are other causes of neuropathy, such as HIV, such as deficiency in vitamins like vitamin B12, vitamin B6, right? Such as deficiency in selenium. But for diabetic patient, if you see that the sugar is okay, but they're having symptoms of neuropathy, please go and do HbA1c to confirm that the sugar is actually okay, right? Okay. Have painful sensation. This for our. Okay, she said, telling me feeling pain on the foot, but okay. Then what can we do for patient with neuropathy? So the management of neuropathy is simple, right? So the management is simple. The best management of neuropathy is giving certain drug. We call it gabapentin, or you can give pregabalin. This is the management. But this one gives symptomatic relief. The best management for neuropathy is you control the blood sugar, you control the blood sugar, right? Apart from that, you control the blood pressure, you control cholesterol. But for symptomatic relief, we give gabapentin and pregabalin, right? So gabapentin. So please don't worry, this video, I will ensure that the video will be in my channel. You can rewatch it when you're free. Okay, so I answered your question now, Ladi. I said those at risk of neuropathy are those who have diabetic neuropathy, those whose sugar is not good, poor glycemic control, those who are not good, those who have abnormal cholesterol, those who smoke, those who have obesity, those who are very tall, right? So I've answered your question. So someone asks, what's the puts you at risk of glaucoma, puts you at risk of cataract, puts you at risk of eye infections. So diabetes can put you at risk fasting blood glucose to be sure. If the patient is not diabetic and is still having that pain, you either send him to us or you send him to orthopedic. So we will investigate for hormones while orthopedic will investigate other causes. Is your next lecturer around? Please let me know. If not, let you answer questions because I'll ask questions concerning these things. What are the specific drugs you use in managing wounds of diabetes? There's not there's no specific drug we use for managing the wounds in diabetes. You have to take wound swab and culture to know the bacteria in the wound, right? There's no any particular drug. Okay, Abila said not yet, so good. The lecturer is not around. There's no particular drug you use for wound in diabetes. You need to take wound swab, culture it, and know the bacteria in the wound. So when you know the bacteria that is in the wound, then you give antibiotic. But before the culture results comes out, you give broad spectrum antibiotic, right? You can give ciprofloxacin, augmentin, ceftriaxone. But when the culture result comes out, then you give specific antibiotic. Okay. So please take paper and biro. Let me ask you some questions fast, fast, fast. If you are ready, you type ready, sir. Take paper and biro. If you're ready, say ready, sir. So today we will not do scenario. We'll just do simple questions. Then we'll call it a day. Okay, so I'm seeing ready, sir. Abila wrote it. Bashir, Sharifa said ready, sir. Good. Umar Gombe said ready, sir. Very good. We are ready. Good. So let's go. Number one. Good. Ready, ready. Okay. Number one. Which of the following is a symptom of severe hypoglycemia? Which of the following is a symptom of severe hypoglycemia? So, A, palpitation. A, palpitation. So the question is, which of the following is the symptom of severe hypoglycemia? I said A, palpitation. B, sweating. B, sweating. C, hunger pangs. C, hunger pangs. D, confusion. If you got the question right, we got it, we got it. If you got the question type, we got it, we got it. If you got the question, type we got it, we got. Or you didn't get it right, repeat question, repeat question. Okay, we got it, good, we got it, good. We got it, very good. So type the answer. I'll give you the question, you type the answer. So what is the answer? Type it. Let's see who will be the first to type the answer. Who will be the first to type the answer? Who will be the first to type the answer? So we said that which of the following is a symptom of... Very good. We have a winner here. So Dr. Kasim wrote it. It's confusion. The question was which of the following is the confusion? Yes, it's confusion. Confusion. Right. Very good. Yes, exactly. Exactly. Very good. Very good. Very good. Okay. So those who did not get the question, as I said, the video will be in my channel. So you go there and watch again, so that we'll try and conclude. Okay. So second question, type ready, sir, or go ahead, sir. Let me go with the second question. So second question. Okay, ready, sir. Okay. I need more ready, sir. I have one ready, sir. Ready. Very good. Carry on, sir. So second question. A patient presented to your PHC with convulsion. A patient presented to your PHC with convulsion. A patient presented to your PHC with convulsion. Okay, you check the blood glucose and it was 2.5. A patient presented to your PHC with convulsion. You check the blood glucose and it was 2.5. You check the blood glucose and it was 2.5. So, how do you treat the hypoglycemia? How do you treat the hypoglycemia? Give the patient Coke. A. Give the patient Coke. B. Give the patient sugar through the mouth. B. Give the patient sugar through the mouth. C. Give the patient honey through the mouth. C. Give the patient honey through the mouth. D. Give the patient IV fluid with dextrose. Give the patient dextrose containing IV fluid. So let me repeat. A patient presented to your PHC with convulsion. You check the blood glucose was 2.5. How do you treat the hypoglycemia? A. You give the patient Coke through the mouth. B. You give the patient sugar through the mouth. C. You give the patient honey through the mouth. And D. You give the IV. Abdurrashid Abubakar, they are the ones very active. For those who did not get it, please ask a hand. So you give IV dextrose. Very good. Asana Gotumo. Very good. Give patient, I have to say dextrose containing IV fluid or IV fluid containing dextrose. Because if you give the patient normal saline, there is no benefit to that, isn't it? If you give the patient normal saline, there is no benefit. Very good. So let's answer question on retinopathy. Let's answer question on retinopathy. Can I go ahead? Right, go ahead, sir. So type Abila, Memuna. Can I go ahead? Okay. Yeah, give IV fluid dextrose. Exactly. Okay. So let's answer. Which of the following is not a risk factor for retinopathy? Which of the following is not a risk factor for retinopathy? A. Hypertension. B. Hyperglycemia. C. Good cholesterol level. Okay. So which one is not a risk factor for retinopathy? We said hypertension, hyperglycemia, normal cholesterol. Very good. Maimuna has answered it for us. C, good cholesterol level, right? So it is bad cholesterol level that will put you at risk. Good. Saudatu, very good. Maria Mukhtar, yes. Good. Yes. C, Abila, yeah. Aminu Abdullah, yes. Aminu Abdul Hamid, yeah. So good cholesterol level should even make it better. Yes. I can see Lois. I can see Khadija. I can see Rebecca. Okay. All right. So that's the answer. Okay. So class, you have done very well for our first online class. I enjoy your participation. Let's keep it up and see how we can finish our course before your holidays. When is your holiday? Please, can you type it? When are you going to receive holiday so that I can plan my time? When are you going to have holiday so that we know if we can be extending this lecture to more than 1 hour? When is your holiday? Type it. When is your holiday? Okay, 20 hour, we have time. 20th December, we have time. So I will try my best to explain things in detail as much as I can. You already have the slide. If you don't have the slides of my lecture as your class rep, he will give it to you, right? So tomorrow we'll continue with the complications of diabetes. We are going to continue with nephropathy. That means diabetes affecting the kidney. All right. So thank you all for participating. Thank you all for participating. If you have more questions, you keep it for tomorrow. Before starting tomorrow's lecture, I'll try my best to answer your questions before the beginning of tomorrow's lectures. So have a nice day, Sharifat Bashir. Have a nice day, Abilad. Have a nice day, Memunat. Have a nice day, Nuruddin. Have a nice day, Siraju. Have a nice day, Esther Adamu. Have a nice day, Bashir. Take care of yourself. Bye bye.